5 months ago, I achieved something I was hesitated to dream of. I became program director at Johns Hopkins. And I remember staring at the email thinking, I'm too young and I don't have the pedigree these halls expect. I started medical school in Ecuador, restarted in Mexico, then moved to the US alone. I pushed through 36-hour shifts through being a woman with an accent in medicine. I worked so hard that sometimes I didn't have time for basic needs such as sleep or food, like many of you did. And then when the opportunity came, I wasn't sure I wanted it. Now I had a husband and I had begun honoring my self-care. And I understood that the struggle I had endured didn't need to be passed on to those who came after me. But I said yes, almost guided by a purpose I didn't yet have words for. And that reality hit. My first months were busy. A lot of administrative work, program updates, schedules, the intensity of recruitment season. I was learning new things every day. I interviewed applicants endlessly, listening to their stories, their dreams, trying not to miss the diamonds in the rough. I remembered that I had once been in their shoes. By the end, I wasn't physically tired, I was emotionally drained. By the end of recruitment season, I felt emotionally drained not because of the people, but because I realized something unsettling. Almost none of us had space anymore to simply think, to breathe, to remember why we chose medicine in the first place. And just as I noticed that loss of reflection, especially in the new generations, I realized that something happening in the background, quietly but powerfully, was possibly related. Technology, especially AI, has been stepping into every corner of our work. It promises efficiency, shortcuts, perfectly written personal statements or messages. But it also made me wonder if we are already struggling to hold on to our purpose. What happens when AI starts shaping our words, our time, and maybe even our identity as physicians? So when I finally returned to patient care, I was happy. The fellow I was working with apologized, saying, sorry, the list is so busy. And I said, you have no idea how much I miss this. There's something about people battling severe illness. There is suffering and complexity, but also a kind of purity, a fierce resilience in their eyes. I was rounding on a patient with end-stage kidney disease, waiting for a heart and kidney transplant. He was an engineer, and every day he was doing something that kept him connected to his passions. One morning he was looking at bicycle designs, and I asked him, what are you planning to build now? And his reply was, I'm planning to buy this one. My wife and I love biking across cities, and after my transplant and a long recovery, I want to bike to Philadelphia. Spark in his eyes was unmistakable. He was imagining a future. And that is why I love what I do. I love being a doctor. I love meeting people at their most human. I love the sharpness and the dedication of all the medical providers who think through complex cases together, who ultimately care for people, for patients. And then as program director, it was time to meet my trainees on one-on-one. How is the job search going? How are you adjusting? What matters to you? Their honesty humbled me. I don't take for granted what they share. But I have noticed something in this new generation I lead. They are sharp, they work hard, but many of them don't have the time or space to reflect on why they are working so hard. Because now, artificial intelligence is everywhere. We are bombarded with alerts, messages, expectations for instant answers. AI scribes write notes, templates, write our paragraphs. During recruitment season, I read so much AI-generated text that people's authentic voices had vanished. And I began asking myself some uncomfortable questions. If we adopt AI in everything, why are we doing it? What are we hoping to gain? More time? Less work? And if it's really more time, what do we want to use it for? Do we know what parts of our profession truly make us come alive? Do we remember our purpose? My first month showed me mine more clearly than ever. I love being a doctor. I love being a teacher. And I love learning new ideas, connecting with humans from all walks of life, admiring them, being inspired by them. So here is what I am teaching my fellows. Yes, learn AI, become fluent in it. Use it to draft, but then edit it fiercely so your voice comes through. Don't let this replace genuine conversation. And let's remember that it is the power of now what we need to reclaim. Let technology handle the routine so you can focus on the profound. Use it to make room for deeper connections, for better questions, for the moments that remind you why you choose medicine at all. Because in a world where AI can write our notes and answer our emails, the leaders who will truly transform healthcare are the ones who help others remember their why. I once hesitated to dream of being where I stand today. And now I understand my purpose more clearly, which is to lead with authenticity, to lead with humanity, and to help others rediscover the calling that brought them into medicine in the first place.